Fact: in the United States, 3 in 4 children in inner cities have witnessed some form of violent assault.
Fact: Chicago public school students receive an average of 40 minutes of art instruction per week, and many receive none.
Fact: every year more than 60,000 students in Chicago fail their vision screenings.
Fact: in Chicago public school, there is only one counselor for every 360 students.
Communities and Schools of Chicago knows that students in this city faced a host of issues. It's the mission of Communities and Schools of Chicago to help students address these issues. We do this by connecting a broad range of social, emotional, health, and enrichment services, all delivered at no cost to schools or students. Because of these connections, we're seeing positive results. Students are healthier, they're safer, and they have a better chance at succeeding in school and in life.
At my school, we really need to learn how to get along with each other.
The students do experience violence. They unfortunately observe people involved in drug transactions, a lot of unstructured play, which leads to a lot of idle time. And I think that's how they get wrapped up in so much aggression and violence.
In response to the school's needs, Communities and Schools of Chicago connected Westcott with Recovery International and the Abraham Lowe Institute's Power to Change program.
We've had an involvement with Power to Change program the last couple years. They see a group of maybe 6 to 10 students, and they come weekly, and the students work with a highly trained professional in which they're able to talk about ways to resolve conflict, and they have a list of tools that they can use. And the most impressive thing is that the students are using those tools and strategies not only at school, but they use them at home.
Communities and Schools of Chicago connect students with a range of services, from vision and oral health care to violence prevention, from theater and arts programs to mental health care, from health and safety programs to music education.
I feel so lucky to have CISC here in Chicago. It's just an extraordinary partner. We're trying to become the best big city school system in America. And we're trying to get better every year at what we do academically. And while that is critically important, before we can even talk about improving academically, we have to get the foundation in place. To do that, our children have to be able to see the blackboard, they have to be fed, their social and emotional needs need to be met. CISC has done an unbelievable job of bringing desperately needed resources into schools and communities that haven't had those things historically.
CISC connects Chicago schools to a host of medical services at no charge, including physicals and immunizations, vision screenings, eyeglasses, asthma screening and care, and oral health care and education.
You know, our neighborhood is rapidly changing, and a lot of our kids don't have health insurance. They don't have the ability to get eyeglasses. Communities and Schools of Chicago has brought in the asthma van. We have a high asthma rate here, and kids get free asthma services. They also get eyeglasses. Luxottica's gift of sight, over like 178 students have received glasses in our school. That's amazing. We had one student that actually had an exam, and we were told that he was legally blind, so they had to make special glasses for him. Some of the biggest problems that we face here, violence prevention and health care and self-esteem issues, Communities and Schools of Chicago has helped us with those issues.
Communities and Schools of Chicago helps schools address students' most pressing needs by training them to identify priorities, find outside partners, schedule programs, evaluate impact, and maintain partnerships.
Through powerful partnerships with schools and agencies, CISC is impacting the lives of more than 60,000 students in more than 160 Chicago public schools every year.
Because of Communities and Schools of Chicago, I'm healthier.
I receive the health care that I need.
My school is safer.
I behave better in class. I want to stay in school.
I feel better about myself.